Meg Ryan's shocking Academy Awards appearance sparks plastic surgery rumors. Meg Ryan's appearance at the 2025 Academy Awards has set off a storm of speculation and concern from health professionals and industry insiders. The 63-year-old actress, once known for her natural beauty and signature smile, left fans and experts stunned with what many described as a dramatically altered face. According to health experts and insiders, Ryan's noticeable facial changes suggest that she may have undergone multiple plastic surgery procedures, some of which may not have produced the desired results. An industry insider spilled to RadarOnline.com, "Her face looks like a frozen mask, and her cheekbones are comically overemphasized." The insider's remarks reflect the growing speculation that Ryan has gone too far with cosmetic enhancements, leaving her with an unnatural appearance that contrasts sharply with the wholesome girl-next-door charm that made her famous in the 1990s. Health professionals, including plastic surgeons and cosmetic experts, have weighed in on the actress's transformation. A Seattle-based surgeon commented that Ryan's lower eyelids appear to have been altered through a blepharoplasty procedure, one that may have been botched. "She's likely had a lower eyelid blepharoplasty that appears botched," the surgeon said. "Her eyes have a tight, hollowed-out look, which can happen when too much skin or fat is removed from the lower eyelid area." The surgeon also noted irregularities in Ryan's neck skin, suggesting that she may have undergone a neck lift that wasn't executed properly. "Her neck skin is irregular and bunches up, especially when she turns her head," the surgeon explained. "This leads me to believe she likely had a neck lift where adequate muscle tightening was not done. The skin's texture and tightness are inconsistent, which can happen when the underlying muscle structure isn't properly addressed." A plastic surgeon from Atlanta weighed in, stating that Ryan appears to have undergone a significant amount of work over the years, including multiple procedures that have altered her facial structure. "Meg has done a lot of work," the surgeon claimed. "It looks like she's had fillers, Botox, a facelift, rhinoplasty, eyelid surgery, and possibly other procedures. The extent of the work is evident in how tight and stretched her skin looks." Another expert from San Francisco suggested that Ryan's reliance on fillers may have contributed to her unnatural appearance. "She should trade fillers for a good facelift," the surgeon advised. "When you rely too much on fillers, it results in a blown-up appearance. Fillers can create volume, but they can also distort the natural contours of the face when overused. A smooth facelift with some fat grafting can restore her natural beauty without looking too overdone." The impact of excessive cosmetic work on Ryan's career and personal life has not gone unnoticed by those in Hollywood. A Hollywood insider suggested that Ryan may have turned to plastic surgery in an effort to maintain her youthful looks and secure roles in an increasingly competitive industry. "The irony is that she may have only made the situation worse," the insider said. "Hollywood is brutal when it comes to aging actresses. There's this immense pressure to look young and flawless, but when the work becomes too obvious, it can backfire." Ryan's transformation has sparked a broader conversation about the pressures that actresses face in Hollywood as they age. In an industry that often values youth and beauty over talent and experience, many female celebrities have turned to cosmetic procedures in an attempt to prolong their careers. However, as Ryan's case demonstrates, the results can be unpredictable and sometimes damaging. Fans have also reacted with mixed feelings to Ryan's new look. On social media, some have expressed concern over the changes in her appearance, while others have defended her right to make decisions about her body without judgment. "She's still Meg Ryan," one fan tweeted. "She doesn't owe anyone an explanation." Another fan, however, expressed disappointment, writing, "It's sad to see her looking so different. She was naturally beautiful, she didn't need all that work." Ryan has not publicly addressed the speculation surrounding her appearance, but this isn't the first time the actress has faced scrutiny over her looks. In the past, Ryan has been candid about the challenges of aging in Hollywood and the pressure to conform to unrealistic beauty standards. "It's hard," she once said in an interview. "You want to feel confident in your skin, but the industry doesn't always make that easy." Experts suggest that Ryan's case highlights the fine line between enhancing one's appearance and overcorrecting it. "Cosmetic procedures can absolutely help maintain a youthful appearance," said a Beverly Hills-based plastic surgeon. "But there's a point where you have to know when to stop. Overfilling the face or over-tightening the skin can create an unnatural, almost cartoonish look. It's about balance." Ryan's changing appearance also raises questions about the long-term effects of certain cosmetic procedures. Fillers, for example, are designed to add volume to the face and smooth out wrinkles, but excessive use over time can stretch the skin and alter the natural shape of the face. Botox, while effective at reducing fine lines, can also lead to a frozen, expressionless look when overused. Facelifts, if not performed with precision, can create tension and distortion in the face's natural contours. Despite the controversy, Ryan remains an iconic figure in Hollywood. Best known for her roles in romantic comedies such as When Harry Met Sally and Sleepless in Seattle, Ryan's charm and talent have earned her a loyal fan base over the decades. However, the industry's relentless focus on appearance has cast a shadow over her career in recent years. She's still one of the most talented actresses of her generation, said a longtime friend of Ryan. People should remember her for her work, not just her looks. But unfortunately, that's not how Hollywood works. The pressure to maintain a youthful appearance in Hollywood is not unique to Ryan. Other high-profile actresses, including Nicole Kidman, Courtney Cox, and Madonna, have faced similar scrutiny over their changing looks. In some cases, the backlash has led actresses to speak openly about their experiences with plastic surgery and the toll it has taken on their mental and emotional well-being. Courtney Cox, for example, admitted in an interview that she had overdone fillers at one point and ultimately chose to have them dissolved. "I realized that I didn't look like myself anymore," Cox said. "It's easy to get caught up in trying to chase youth, but sometimes you just have to let go." Ryan's case serves as a cautionary tale about the dangers of overcorrecting and the unrealistic standards that Hollywood imposes on aging actresses. While cosmetic procedures can certainly enhance appearance and boost confidence, they can also lead to unintended consequences when overused or improperly executed. As Ryan navigates this new chapter in her career and life, fans and industry insiders alike hope that she will find peace and confidence in her natural beauty. "She's beautiful with or without the work," said a close friend. "I hope she knows that." Whether or not Ryan chooses to address the rumors, one thing is clear: the conversation about plastic surgery and Hollywood's obsession with youth is far from over.